Hello from the Leprosy Mission Trust India from the research domain. At the TLMTI, we work on several themes for evidence generation and basic science, social science, clinical practice, operational research are some of these areas where we are working on. To reduce transmission, we have developed a tool that will help in early detection of leprosy. So this is a screening tool which helps to patient, doctors or clinicians to understand whether a person is harboring the infection before the clinical signs and symptoms have come out. So this will enable the person to treat a patient early and before actual nerve damage happens. This is in the research mode and we are in the process of validating this tool. We are also working on environmental factors, especially in those areas which are highly endemic for leprosy, to understand whether there are the soil and water and other areas of transmission that could possibly be involved in transmission. And treatment for leprosy has been going on since 1982 and it has been hugely successful. But we have found that the components of the drugs, multi-drug therapy, could have potential side effects. And anemia is one of them, which is quite significant. And these drugs need to be taken for a prolonged period, that is 12 months. And many a time we have been asked, requested whether the duration could be shortened, whether the pills could be reduced, and suppose they have any complications, then the pill burden increases. So we are looking at a clinical trial which we just started implementing last month, where we are giving once a month 3-drug regime versus MDT to see whether any shortening of the regimen can be done successfully. There is well evidence established treatment of complications in the form of steroids, but where complications become recurrent and chronic, people tend to become dependent on steroids, and which is not a very good thing. Dependence means they get complications due to the drugs. They get other kinds of problems like diabetes, hypertension, they get weakened bones, they develop a certain kind of face which is round and fatty, and thinned arms, which is not nice. And steroid dependence makes people dependent on steroids lifelong, potentially making them prone to many kinds of infections, rare infections, difficult to treat infections. So we are doing a trial of a steroid alternative drug which is known as methotrexate, and it's a multi-country study where India is a part, and we are looking whether methotrexate alone or in combination of low-dose steroids could work in complications so that we can avoid these steroid-related issues. Then we also know that ulcers are a perennial problem in leprosy because of the loss of sensation in the feet. So recurrent ulcers, worsening of ulcers are challenges for clinicians and difficult for patients too. So we in a rural setup in a district in India, we have done extensive work among ulcers and found what is the true prevalence of ulcers among the communities. We have done a frontline delivery of an intervention which was very successful, and in this the frontline workers delivered the self-care intervention at the doorstep of the patient. Earlier it used to be hospital based, but since it was doorstep and they also monitored monthly in their home visits, there was a massive marked improvement in the ulcers. And we are very pleased that the public health system has adopted the curriculum within their training program. We also did a lot of data mapping so that we could find hotspots that would enable focused delivery of interventions, focused allocation of resources. And we have done the mapping on several layers, starting from very, very village level to district level to a state level. So that gives an entire picture of the disease in an area, and helps the public health officials plan their interventions or plan their program in a much focused manner. Then we also realize that leprosy doesn't just exist as a leprosy in a patient. He is prone to many other kinds of illnesses, for example, non-communicable diseases, or mental health issues, or just normal headache, fever, appendicitis, gallbladder issues, lack of vision, or dental issues, hearing issues. So when leprosy plus problems are there, we call it multi-morbidity, and that is something we want to see, whether a person affected by leprosy has access to treatment or management of multi-morbid conditions, and whether it's available easily to them, and how difficult it is to manage leprosy management and other issues or else. So we are looking at leprosy and addressing the multi-morbidity too. We are writing some proposals which looks at early nerve damage. So there are equipments, small handheld equipments that have been used in diabetes in the Western countries, and we want to see whether such equipments could be modified and used within our lower middle income countries, so that non-skilled workers can use it in the field and help us to detect early nerve damage. By doing so, we would be preventing a lot of irreversible disability. This equipment will detect pain, temperature, pressure, touch, vibration, and it also gives values so that we know what the cutoff values of normal and abnormal are. So this is something we are proposing and writing for calls that are open. Then we are also looking hugely at mental health and its interventions. We had the first paper from India which talked about prevalence, and we found that 40% of people suffer from depression, and about 30% odd numbers suffer from anxiety. And we all know that they have lack of self-esteem, lack of confidence. There is a lot of anger, fear, doubt. And in order to address these, we are again proposing interventions that could help, interventions that could be delivered by peers, by community health workers, specialized care by trained counselors. So this is an area where we are capacity building ourselves and also developing programs that could help people affected by leprosy. We are also doing a bit of qualitative research. We do not know what is recovery in leprosy. Currently, cure means bacteriological cure, means the smear that they have, the skin smears that they have, positive turns negative. But that is just one small aspect. When people have to live with disabilities, they consider themselves not healed. When they have continuous reactions after treatment is over, they consider themselves not healed. If they have patches which have not gone after the treatment, they consider themselves not recovered. They want to be back to normal before they started having this disease. But many a time, this is a sad reality that they would have to live with the disease. So we felt that expectations of patients are this high, but what is being provided is probably at this level. Where does a balance happen, and what needs to be informed to the patient so that his expectations and what healthcare can provide or deliver is at the same level. So we are doing a qualitative study on what recovery or healing is from the healthcare perspective and also from the patient's perspective. So interesting findings again, and it's just not related to health and physical well-being, but a lot of biopsychosocial, economic, spiritual aspects are emerging, which is quite an interesting finding for us, which will help design interventions according to the needs that are developing. So these are a few areas which we are working on. There's still a lot to do, and we are speeding against time, bringing evidence to the body of literature, body of science and practice. We are speeding ahead in writing proposals, looking at the needs, and a very big important area is that people affected or people with lived experiences are a part of this research domain. We ideate with them, we discuss solutions with them, we take solutions to the community to understand whether the solutions will work or not. We have FGDs among people affected by leprosy, and you could call it a participatory domain, wherein everything starting from conceptualizing the proposals, the ideas, to implementing, to manuscript writing, to dissemination even within the community and within public health system is undertaken by people affected. So it is our endeavor that research will, there will be path-breaking researches coming from Leprosy Mission, and we will be able to bring a change in the way management of leprosy happens at all levels among all stakeholders.